So good day everyone. Today I'm gonna report about the Cryptosporidium parvum, which is a parasitic protozoa. So Cryptosporidium parvum is a microscopic parasite that causes the diarrhea disease Cryptosporidiosis. So both the parasite and the disease are commonly known as crypto. Cryptosporidiosis disease causes watery diarrhea. It caused by microscopic germs parasites called Cryptosporidium. So although crypto can affect all people, some groups are likely to develop more serious illness. So Cryptosporidium is the kind of parasite that is protected by an outer shell that allows it to survive outside the body for long periods of time and makes it very tolerant to chlorine disinfection. So Cryptosporidium is a leading cause of waterborne diseases among humans in the United States. While this parasite can be spread in several different ways, water is the most common way to spread the parasite. Pathogens and environmental life cycle of Cryptosporidium parvum. So there are many species of Cryptosporidium exist that infect humans and a wide range of animals. The Cryptosporidium parvum is a coccidian protozoan parasite. It is a parasitic disease of the mammalian intestinal tract. So before it was considered as clinically important human pathogens. So it is a waterborne opportunistic infection that affects humans. So the life cycle of Cryptosporidium. It is a taxonomically classified as protozoa since its oocyst releases four sporozoites. So the first process is sporulated oocysts containing four sporozoites are excreted by the infected host through feces and possibly other routes such as respiratory secretion. So the second process is the transmission of Cryptosporidium. It occurs mainly through ingestion of fecally contaminated water, for example, drinking or recreational water, or food, or following direct contact with infected animals or people. So cattle are known to be the major host for C. parvum or crypto. So when the host releases its oocysts, and then the transmission is through ingestion of contaminated water, then once the host ingested the oocysts, the symptoms for crypto will start. Following ingestion by a suitable host. This is where excitation occurs and the sporozoites are released and parasitize the epithelial cells of the gastrointestinal tract and possibly the respiratory tract. So in these cells, usually within the brush border of the parasites undergo a sexual multiplication and then sexual multiplication that producing microgametes or male and macrogametes or female. So upon fertilization of the macrogametes by microgametes, that rupture from the microgametes oocysts develop and sporulate in the infected host. Zygote give rise to two different types of oocysts, the thick wall and the thin wall. Thick-walled oocysts are excreted from the host into the environment, whereas thin-walled oocysts are involved in the internal autoinfective cycle and are not recovered from stool. So extracellular stages has been reported, but their relevance in the overall life cycle is unclear. So muna siya tong process sa ingestion by suitable host. So next, the life cycle is complex. There are both sexual and asexual cycles, and there are 6 distinct developmental stages. So first is the excitation of the orally ingested oocysts in the small bowel with release of the 4 sporozoites. The next stage is the invasion of intestinal epithelial cells via the differentiated apical end of sporozoites within a vacuole formed both host and parasite membranes. So next is the differentiation of microgametes and macrogametes. The next stage is the fertilization, initiating sexual replication. So the fifth stage is the development of oocysts, and the last stage is the formation of new infectious sporozoites within the oocyst, which is then excreted in the stool. Next is the diagnosis and detection. Diagnosis of cryptosporidiosis is made by examination of stool samples. Because detection of Cryptosporidium can be difficult, patient may be asked to submit several stool samples over several days. Most often, stool specimens are examined microscopically using different techniques. The acid-fast staining, direct fluorescent antibody, and enzyme immunoassays for detection of Cryptosporidium. There are also a molecular method, for example, polymerase chain reaction. These molecular methods are increasingly used in reference diagnostic labs since they can use to identify Cryptosporidium at the species level. So these tests for Cryptosporidium are not routinely done in most laboratories. Therefore, healthcare providers should specifically request testing for this parasite. Symptoms of Cryptosporidiosis generally begin 2 to 10 days after becoming infected with the parasite. The most common symptoms of Cryptosporidiosis is water diarrhea. Symptoms include stomach cramps or pain, dehydration, nausea, fever, and weight loss. Symptoms usually last about 1 to 2 weeks in persons with healthy immune systems. Occasionally, people may experience a recurrence of symptoms after a brief period of recovery before the illness ends. Symptoms can come and go for up to 30 days. In immunocompromised person or people with weakened immune system, small intestine is the site most commonly affected. The Cryptosporidium infections could possibly affect other areas of the digestive tract or the respiratory tract. People with weakened immune systems may develop serious chronic and sometimes fatal illness. Examples of people with weakened immune systems include people with HIV or AIDS, those with inherited diseases that affect the immune system, and cancer and transplant patients who are taking certain immunosuppressive drugs. Sources of infection and risk factor. Crypto lives in the intestine of infected humans or animals. An infected person or animal shed Cryptosporidium parasites in the stool. You can become infected after accidentally swallowing the parasite. So crypto may be found in soil, food, water, or surfaces that has been contaminated with the feces from infected humans or animals. Millions of cryptoparasites can be released in a bowel of movement from an infected human or animal. Shedding begins when the symptoms begins and can last for weeks after the symptoms stop. So crypto is not spread by contact with blood. Crypto can be spread by putting something in your mouth or accidentally swallowing something or beverages that has come in contact with the stool of a person or animal infected with crypto. Eating uncooked food contaminated with crypto. All fruits and vegetables you plan to eat raw should be thoroughly washed with uncontaminated water. So next is touching your mouth with contaminated hands. Hands can become contaminated through a variety of activities such as touching surfaces that has been contaminated by stool, changing diapers, caring for an infected person, and handling an infected animal such as cow or calf. People with greater exposure to contaminated material are more at risk for infection, such as children who attend childcare centers, childcare workers, parents of infected children, ages 75 years and older, people who drink untreated shallow, unprotected wells, ocean, lakes, rivers, ponds, etc., sexual contact, and international travelers. So travelers to developing countries may be at greater risk for infection because of poorer water treatment and food sanitation. But cryptosporidiosis occurs worldwide. Once infected, people with decreased immune system are most at risk for severe disease. The risk of developing severe disease may differ depending on each person's degree of immune suppression. Next is treatment. Most people who have healthy immune systems will recover without treatment. Diarrhea can be managed by drinking plenty of fluids to prevent dehydration. People who are poor in health or who have weakened immune systems are at higher risk for more severe and prolonged illnesses. Young children and pregnant women may be more susceptible to dehydration resulting from diarrhea and should drink plenty of fluids while ill. Rapid loss of fluids from diarrhea may be especially life-threatening to babies. Therefore, parents should talk to their healthcare providers about fluid replacement therapy options for infant. Anti-diarrheal medicine may help slow down diarrhea, but a healthcare provider should be consulted before such medicine is taken. HIV-positive individuals who suspect they have cryptosporidiosis should contact their healthcare provider. For those persons with HIV or AIDS, antiretroviral therapy and that improves the immune status will also decrease or eliminate symptoms of cryptosporidiosis. However, even if symptoms disappear, cryptosporidiosis is often not curable and the symptoms may return if the immune status worsens. So, example of medicine for cryptosporidiosis is nitazoxanide. It is treatment that has been FDA approved for treatment of diarrhea caused by Protozoa Cryptosporidium. So protozoa are suspected as the cause when diarrhea lasts more than 7 days. So nitazoxanide is an in-class of medication called anti-protozoal agents. So for prevention and control, the following recommendations are intended to help prevent and control cryptosporidiosis, or crypto for short. First is practice good hygiene everywhere. Help yourself and your loved ones healthy by washing your hands often with soap and water, especially during key times when you are likely to spread germs. Alcohol-based hand sanitizers are not effective against crypto. Washing hands at key times with soap and water can help prevent infections. So, childcare facilities. Exclude children who are sick with diarrhea from childcare setting until the diarrhea has stopped. Clean, sanitize, or disinfect toys and surfaces to prevent germs from spreading easily. Wash hands regularly with soaps and water to keep kids and caregivers healthy. Next is move adults with diarrhea to jobs that minimize opportunities for spreading crypto. For example, the administrative work instead of food or drink preparation. So next prevention is at a pool, lake, and other places we swim. Do not swallow or let kids swim if sick with diarrhea. If crypto is diagnosed, wait 2 weeks after diarrhea has stopped to go swimming. So do not swallow the water. Take young children on bathroom breaks or checks their diapers every 60 minutes. Change diapers in bathroom or diaper changing area, not water side, to keep germs and poop pop out of the water. So avoid water that might be contaminated. Do not drink untreated water or use untreated ice from lakes, rivers, springs, ponds, streams, or shallow wells. Follow advice given during local drinking water advisories. Avoid food that might be contaminated. Do not eat fruits and vegetables washed in water that might be contaminated. Practice extraction while traveling. Do not drink inadequately treated water or use ice when traveling in countries where the water might be unsafe. Avoid eating uncooked food when traveling in countries where the food supply might be unsafe. So that would be all. Thank you for listening.